How many people are in aged care with dementia and Alzheimer's and memory loss, and it's the cholesterol-lowering medication? I believe personally this verges on criminal, especially when you hear what I'm about to say. There's a quiet crisis unfolding in senior health, one that very few people are talking about. Every year, millions of older adults begin to notice their memory slipping, their focus fading, and their independence slowly slipping through their fingers. Families watch with worry, wondering if dementia is setting in, and seniors themselves often wonder, is this just aging or something else? But here's the truth that may shock you. In many cases, the culprit isn't age at all. It's not your brain wearing out. Instead, it's something far more preventable, far more silent and hidden right inside your own medicine cabinet. For decades, doctors have prescribed certain medications to help with common health problems, trouble sleeping, anxiety, pain, allergies, bladder issues, and more. Yet, what most seniors don't realize is that some of the most widely prescribed medications can actually interfere with brain function. Not slowly, not subtly, but in a way that can mimic dementia itself. And that's why today I want to bring this message straight to you. Seniors, beware, because if you or a loved one are taking one of these 9 popular medications, you may be unknowingly putting your memory, your sharpness, and even your independence at risk. This isn't about fear, it's about awareness. I'll be walking you through the science, the real-life stories, and the safer paths forward. And as we go, you'll begin to see how powerful knowledge can be in protecting your brain. Before we start, drop in the comments from where you are watching this video and what health topic you'd like to see in the next video. As a special thank you for joining us today, we're giving away 100 free copies of my best-selling book to subscribers. So, if you haven't already, make sure to hit that subscribe button and leave a comment about why you want to win my best-selling book. Dementia and its real impact on seniors. So what else have they done to try and lower heart disease? Put everyone over the age of 40 on cholesterol-lowering medication, yeah? Cholesterol-lowering medication. Are you ready for the side effects? Dementia, muscle wasting, Alzheimer's, memory loss, and they've just added another one, breast cancer, because our sex hormones are made from cholesterol. Dementia is more than occasional forgetfulness. It's a progressive loss of cognitive function that interferes with daily life, often leaving individuals and their families feeling helpless. Yet despite its prevalence, many seniors and even some healthcare professionals misunderstand how it begins. Memory lapses in aging are not always natural. They can be signals of a brain under attack. Statistics show that over 55 million people worldwide live with some form of dementia, and this number is projected to triple by 2050. But here's a crucial point. Aging alone does not automatically trigger dementia. While minor forgetfulness can be a natural part of growing older, rapid cognitive decline often has preventable or modifiable causes. Among them, medication-induced cognitive impairment is one of the least recognized yet most dangerous contributors. Seniors are particularly vulnerable because the aging brain changes the way drugs are metabolized. As liver and kidney functions slow down, medications that once seemed safe can linger longer in the body, reaching higher concentrations and interacting unpredictably with other prescriptions. The same pill that eased your anxiety or helped control blood pressure might also disrupt vital neurotransmitters in your brain, affecting memory, focus, and reasoning. Understanding this connection is essential. It's not about stopping medications you need, but about awareness, vigilance, and partnership with your healthcare provider. When medications are used safely and wisely, they can support health rather than undermine it. But ignoring the warning signs can lead to a frightening acceleration of cognitive decline, one that feels sudden, uncontrollable, and devastating. How medications can trigger rapid cognitive decline. So this is a drug a person can be on 10 years and just stop. The side effects will be beneficial. He said to me, we're on our third day, and he said, I've got my wife back. He said, we are not putting her, we did not want to, but he said it was getting so difficult. And they both had tears in their eyes. How many people are in aged care with dementia and Alzheimer's and memory loss, and it's the cholesterol-lowering medication? I believe personally this verges on criminal.
Many seniors trust their medications blindly, believing that if a doctor prescribed it, it must be safe. But here's a sobering reality. Some drugs, even when taken exactly as directed, can have hidden effects on the brain, effects that often go unnoticed until memory lapses, confusion, and disorientation appear. Medications can trigger cognitive decline in subtle ways. Some interfere directly with neurotransmitters, the chemical messengers your brain relies on to process information, form memories, and maintain focus. Others affect blood flow to the brain, disrupting the oxygen and nutrients neurons need to function optimally. And some drugs simply have side effects that accumulate over time, quietly undermining your cognitive resilience. The danger is compounded when multiple medications are combined. Polypharmacy, the use of 5 or more prescription drugs, is extremely common among seniors. Each additional pill increases the risk of interactions, magnifying the impact on memory and reasoning. What begins as mild forgetfulness can accelerate quickly, creating confusion that feels sudden but is actually the result of months, sometimes years, of silent brain stress. The most alarming part? Many of these medications are prescribed to address conditions seniors often face every day: insomnia, anxiety, allergies, high blood pressure, or chronic pain. They are marketed as life-improving solutions, and yet, without proper oversight, they may be quietly eroding the very mind they are meant to protect. Now let's reveal the first 3 medications on the list, the ones most commonly overlooked, but which can be quietly accelerating dementia in seniors. Understanding these drugs and their effects will give you the power to discuss safer alternatives with your doctor before it's too late. Hidden dangers in everyday prescriptions. 1. Anticholinergics.
You see, the brain needs fat. So a study was developed started, I should say. A study was started in the little town of Framingham. In the little town of Framingham, 30,000 people were assessed. This has been going for 30 years. They started it to prove that cholesterol causes heart disease, but it hasn't. It hasn't at all. Some people with low cholesterol levels are having heart attacks. We had a lady from England do our program. She said, I had a heart attack recently and I had a cholesterol level of 150. She said they did an angiogram, my arteries were clear. What happened there? She was under great stress. You know, great stress can constrict the arteries. There are many factors that come into play, as you probably can see. But what this study showed, the Framingham Heart Study, that's what it's called, it showed that people with high cholesterol levels don't get Alzheimer's. Why don't they get Alzheimer's? Because what does the brain love? Fat. So what's a good cholesterol level? Oh, probably 200, 250. So see what's happened? They've got many people on cholesterol-lowering medication. They've got everyone on the fat-free diet, and because you're not getting the feeling of satiation or satisfaction when you eat, the person eats huge amounts of carbs. They've lowered the cholesterol level so they can get more people on cholesterol-lowering medication, and people are eating margarine. Oh, surely all of that has reduced heart disease. No, it's still the #1 killer in the industrialized nations today, neck to neck, as I said, with cancer.
Often prescribed for bladder problems, allergies, or even depression, anticholinergics block a neurotransmitter called acetylcholine, which is crucial for memory and learning. In seniors, blocking acetylcholine is like cutting the power to the circuits of a complex machine. Over time, this disruption can accelerate memory loss, confusion, and even delirium. Imagine trying to remember where you put your glasses while your brain's internal wiring is slowly being short-circuited. Common anticholinergics include drugs for urinary incontinence, certain antihistamines, and some antidepressants. The effects may start subtly misplacing items, forgetting appointments, but they often escalate if the drug continues long-term. 2. Benzodiazepines, widely prescribed for anxiety, insomnia, or panic disorders. Benzodiazepines are designed to calm the nervous system. They are effective in the short term, but in older adults, they carry a significant risk of cognitive impairment. Benzodiazepines slow brain activity and can cause drowsiness, confusion, and memory gaps. Prolonged use has been linked to a higher risk of developing dementia. Many seniors who rely on these drugs don't realize the very relief they seek may come at the cost of mental sharpness and independence. 3. Proton pump inhibitors, PPIs. Commonly prescribed for acid reflux and heartburn, PPIs are often taken daily for years. Recent studies have linked long-term use of PPIs to an increased risk of dementia. The exact mechanism is still being studied, but evidence suggests PPIs may reduce the absorption of essential nutrients like vitamin B12, which is critical for brain health. Seniors taking these medications may feel safe because heartburn relief is immediate, but the silent damage to neurons can build slowly over time. These first 3 medications highlight a critical truth. The most ordinary, trusted drugs can have extraordinary consequences for the aging brain, but the risk doesn't stop here. The next 3 medications take the danger even further, particularly when combined with other prescriptions or pre-existing health conditions. Escalating risks to your brain. 4. Statins, cholesterol-lowering drugs. Statins are some of the most widely prescribed medications in the world, praised for their ability to lower cholesterol and protect the heart. For many seniors, they are considered almost essential, but recent research has raised concerns about cognitive side effects in certain individuals. While statins help prevent heart attacks, they can sometimes interfere with the synthesis of cholesterol in the brain, a critical component of neuron function and repair. Seniors may experience subtle memory issues or brain fog, which often go unnoticed because heart protection feels like a higher priority. This creates a difficult trade-off, and careful monitoring with your doctor is essential to balance heart health and cognitive well-being. 5. Opioid pain medications. Chronic pain is a reality for many seniors, and opioids are often prescribed to provide relief. Yet these drugs can profoundly affect the brain, particularly in older adults. Opioids bind to receptors that regulate pain, but also impact areas responsible for memory, attention, and executive function. Extended use can lead to slowed thinking, confusion, and, in some cases, a faster progression of cognitive decline. Seniors who rely on opioids daily may notice that they are not only physically dependent but mentally dulled, losing the mental clarity that once allowed them to engage fully with life. 6. Corticosteroids. Used to reduce inflammation in conditions like arthritis, asthma, or autoimmune disorders, corticosteroids can save lives and improve daily functioning. However, long-term use can disrupt brain chemistry, leading to mood swings, anxiety, and memory problems. Seniors may find themselves forgetting conversations, struggling to recall names, or feeling unusually irritable signs that often get misattributed to normal aging. What makes corticosteroids particularly insidious is that their life-saving benefits can overshadow the cognitive costs, leaving seniors and families unprepared for the impact on the brain. As you can see, the risk is cumulative. The first 3 medications subtly weaken the brain's wiring. These next 3 statins, opioids, and corticosteroids interact with that same system, intensifying memory issues, confusion, and cognitive vulnerability. Seniors taking multiple prescriptions may experience a domino effect, where each new drug adds strain to an already taxed brain. And the danger doesn't stop at 6. The final 3 medications on our list are the ones that often tip the balance, pushing cognitive decline into a rapid, noticeable, and sometimes frightening stage. Understanding these is crucial to safeguarding your memory and quality of life.
It was probably 5 years ago now at Living Springs Retreat. We had a scientist do our program with his wife who was a nutritionist. They're both in their late 60s. She's 69. She said, I've been a nutritionist for 40 years. So she said, I was educated in university 40 years ago, and she said 40 years ago we were told that a cholesterol level of 300 and under was perfectly normal. Has the body changed? No. So can you see what medicine has done? They've dropped the levels. They now say that if you are over 190, you're a walking, talking heart attack. I have had people say that to me. One girl was 30, her cholesterol levels were 192, and the doctor said, you've got to go on cholesterol-lowering medication. 30! We had a pharmacist do our program. She said, this really annoys me. She said, I know it's only a money-making scheme. Because if you go on an antibiotic, you're on it for a week. If you go on cholesterol-lowering medication, how long are you told you're on it for? Life. Now, she said, I'm a pharmacist. I'm not against drugs. It's my business. But she said, this annoys me.
The cumulative impact on memory. 7. Antipsychotics, often prescribed to manage mood disorders, agitation, or behavioural issues in seniors. Antipsychotics can carry serious cognitive risks. These medications work by altering brain chemistry, dampening overactive neural pathways, and stabilising mood. However, for older adults, especially those already vulnerable to cognitive decline, antipsychotics can accelerate memory loss and confusion. Seniors may feel emotionally numb, forgetful, or disoriented, sometimes startling their families with sudden lapses in awareness. The subtlety of this decline makes it easy to dismiss as just old age, but in reality, it is a direct consequence of chemical interference in the brain. 8. Sleep medications, sedative hypnotics. Prescription sleep aids can provide relief to seniors struggling with insomnia, a condition that affects quality of life and overall health. But these drugs often slow brain function and alter neurotransmitter balance, leaving seniors groggy, forgetful, or confused even during the day. Chronic use can interfere with memory consolidation, the very process your brain uses to store new information. Picture trying to build a library while the workers are dozing off on the job. This is essentially what happens to your memory with prolonged sleep medication use. 9. Diabetes medications, certain insulin and hypoglycemic drugs. Maintaining healthy blood sugar is critical for seniors, but some medications used to regulate glucose can inadvertently affect cognitive function. Hypoglycemia or low blood sugar episodes can cause temporary confusion and, over time, may contribute to faster cognitive decline. Seniors may experience sudden forgetfulness, difficulty concentrating, or moments of disorientation that feel alarming. Repeated episodes can weaken the brain's resilience, leaving memory and attention more vulnerable. Taken together, these 9 medications represent a hidden threat that is often overlooked by both patients and caregivers. Each drug on its own may pose moderate risks, but in combination, the cumulative effect can be profound. Seniors taking multiple prescriptions may find that what starts as occasional forgetfulness escalates into confusion, disorientation, and difficulty performing daily tasks. Real-life examples bring this danger into focus. Consider Mary, a 72-year-old retired teacher who took medications for heartburn, insomnia, and high blood pressure. Over 2 years, her family noticed subtle changes. She misplaced items, repeated questions, and struggled to follow conversations. It wasn't until her doctor reviewed her medications that they realized the combination of drugs was accelerating cognitive decline. With careful adjustments and alternatives, Mary regained mental clarity, demonstrating that awareness and action can make all the difference. The message is clear. Seniors don't have to accept memory loss as a natural inevitability. Recognizing the medications that may contribute to cognitive decline is the first step toward prevention and recovery. Protecting your brain while managing medications. Understanding the risks of these 9 medications is one thing, but taking meaningful action is what truly preserves memory and cognitive function. The first step is awareness. Seniors should keep an updated list of all medications prescription, over-the-counter, and even supplements. Sharing this list with your doctor at every visit allows for careful review, potential substitutions, or dosage adjustments that can dramatically reduce cognitive strain. Consultation with your healthcare provider is essential. Never stop or change a prescription on your own, but do ask questions. Are there safer alternatives? Can dosages be lowered? Could non-drug approaches work just as well? For example, mild anxiety or insomnia may sometimes be managed through cognitive behavioral therapy, relaxation techniques, or guided sleep routines, reducing reliance on medications like benzodiazepines or sedative hypnotics. Lifestyle habits are equally critical. Exercise, even gentle daily movement, increases blood flow to the brain, supporting neuron health and memory retention. Cardiovascular workouts, strength training, and balance exercises all contribute to cognitive resilience. Nutrition also plays a major role. Diets rich in leafy greens, berries, omega-3 fatty acids, and whole grains have been consistently linked to improved brain function in older adults. Conversely, excessive sugar, processed foods, and highly refined carbohydrates can accelerate cognitive decline, particularly when combined with medications that already stress brain chemistry. Mental stimulation is another cornerstone of prevention. Engaging in puzzles, reading, learning new skills, or social activities keeps neurons active and strengthens neural networks. Even simple habits like keeping a journal, practicing memorization techniques, or discussing current events with friends can preserve memory and focus. Cognitive exercises act as a protective layer, helping your brain resist the subtle impacts of medications that may otherwise erode memory. Sleep hygiene is equally important. Avoid excessive reliance on sleep medications. Instead, prioritize natural sleep cues, maintain a regular schedule, limit caffeine in the afternoon, and keep your bedroom dark and quiet. Adequate restorative sleep helps consolidate memories, supports neurotransmitter balance, and allows the brain to repair itself overnight. Finally, consider regular health screenings. Vitamin B12, thyroid function, and blood sugar levels directly impact cognitive function. Seniors often overlook these tests, yet deficiencies or imbalances can amplify the effects of medications. Combined with proper hydration, stress management, and avoiding alcohol or smoking, these strategies form a comprehensive approach to brain protection. The takeaway is clear: seniors don't need to feel helpless. By actively monitoring medications, consulting with healthcare professionals, and embracing lifestyle interventions, you can significantly reduce the risk of rapid cognitive decline. The brain is resilient, and with the right support, it can maintain clarity, memory, and focus well into advanced age. Taking control of your medications and mind. Awareness is your most powerful tool in protecting your cognitive health. Many seniors unknowingly allow medications to dictate their mental state because they assume prescriptions are harmless if taken as directed. But as we've explored, even everyday drugs can accumulate hidden risks over time. Knowing what you take, why you take it, and how it affects your brain is essential for maintaining independence and mental clarity. Monitoring doesn't have to be complicated. Simple steps like keeping a medication journal, noting any memory lapses, confusion, or mood changes, and reviewing these observations with your doctor can reveal patterns that would otherwise go unnoticed. In many cases, cognitive decline attributed to normal aging is actually medication-related and reversible when adjustments are made. Family members and caregivers play a crucial role as well. Observing subtle shifts in behavior, such as repeated questions, misplaced items, or difficulty following instructions, can provide early warning signs. Early intervention can prevent these issues from escalating into severe memory loss or dementia. Seniors who actively involve their support network often experience better outcomes because they are not facing these challenges alone. Ignoring these risks carries significant consequences. Cognitive decline can affect daily activities, reduce independence, and create emotional strain for both seniors and their families. Mismanaged medications can accelerate this process, turning preventable memory issues into long-term impairment. The reality is that the longer these warning signs go unaddressed, the harder it becomes to reverse the damage. But the encouraging news is that timely awareness, careful monitoring, and proactive steps can make a dramatic difference. By taking control today, asking questions, tracking medications, and adopting protective lifestyle habits, you can safeguard your mind and maintain mental sharpness for years to come. Your brain is not a passive victim of aging. It's an organ that responds to care, attention, and informed action. The sooner you act, the stronger and more resilient it remains. Seniors, the message is urgent but empowering. Memory loss and cognitive decline are not unavoidable. The 9 medications we discussed, anticholinergics, benzodiazepines, PPIs, statins, opioids, corticosteroids, antipsychotics, sleep aids, and certain diabetes medications carry hidden risks that can accelerate dementia if left unmonitored. The good news is that with awareness, action, and support, you can protect your brain, preserve your independence, and maintain the life you love. The first step is simple but powerful. Know every pill you take, understand its purpose, and discuss its impact on memory with your doctor. Don't wait for forgetfulness to become a problem. Early intervention can reverse or slow cognitive decline. Combine this vigilance with lifestyle practices that strengthen your brain: proper nutrition, regular exercise, mental stimulation, restorative sleep, and emotional balance. These aren't just recommendations. They are scientifically proven ways to maintain clarity, focus, and resilience well into your senior years. What can seniors do? Taking back control. At this point, you may be feeling 2 emotions at once: alarm because so many of these medications are familiar names, and relief because now you understand what could be happening to your memory or the memory of someone you love. The first and most important step is this: never stop any medication on your own. That cannot be stressed enough. Some drugs can cause serious withdrawal effects if stopped suddenly. Always talk with your doctor before making any changes. But here's what you can do immediately. Start asking questions. Bring this knowledge with you to your next appointment. Say, "Doctor, I've learned that some medications may increase dementia risk. Are any of mine on that list? Are there safer alternatives we could consider?" Most doctors will respect a patient who is informed and proactive. Sometimes it's as simple as adjusting a dose, switching to a newer medication, or exploring non-drug approaches. Remember Mary's story, or imagine countless seniors just like her, subtle changes in memory that were mistaken for normal aging, later traced back to medications. Acting sooner rather than later made all the difference. Your story doesn't have to follow the same path. The power to protect your mind is in your hands today. Take control, ask questions, and embrace the strategies that preserve cognitive health. Your memory is precious, your independence invaluable, and your life deserves clarity, confidence, and mental sharpness. By acting now, you can reclaim control, protect your future, and live with the peace of mind that comes from knowing your brain is cared for.
If this video helped you understand how to do that, please give it a thumbs up. It truly helps others find this important information. And if you haven't already, subscribe to the channel and hit that notification bell. Thanks for watching, and as always, stay informed, stay healthy.